Imagine going to the drugstore for prescription medication and walking out $400 poorer. Each year, the nearly 50 million Americans who don't have insurance must pay out of pocket for prescription drugs. One of the hardest hit groups of Americans is our senior citizens. Champaign County's Beatrice Stratton faces the burden of paying full price for her meds.
After my husband passed away, which was a long time ago, I discovered that I was diabetic. One month I spent $950 on medicine. Some of those medicines were for 3 months, but I was spending at least $400 a month. I can't afford $400 a month for medicine.
And Stratton has health insurance. She's enrolled in Medicare Part D, the government-sponsored prescription drug program. Medicare Part D clients like Stratton have to pay full price for medicine when the costs reach a specific limit. They call it the donut hole, the point where insurance no longer covers the cost of buying prescription medication until the next threshold is reached. According to Walgreens pharmacy manager Rajul Gandhi, the donut hole may be painful.
It's about $2,800 patients pay up front, then they're in the donut hole. And then once they reach about $4,500, then it kicks back in.
The health reform bill passed in March promises to make prescription drugs more affordable by slowly closing that gap. By 2020, Medicare Part D users will only pay 25% for both brand name and generic drugs. Increasing prescription drug coverage will begin in 2011 and end 10 years from now. Consumers who reach the coverage gap this year will receive a $250 rebate. But the Champaign County Healthcare Consumers, or CCHCC, want to see bigger changes happen faster. CCHCC Executive Director Claudia Lenhoff is active in voicing the group's concern.
The donut hole really is legally sanctioned robbery, of Medicare beneficiaries. It's completely unethical. It was basically preying on a very vulnerable population, and we need to get rid of it. We're going to do everything that we can to make everybody aware.
Stratton is also a member of Healthcare Consumers who wants to see a change. She says some of her friends have risked their own health just to save money.
I've heard them talk about, cutting pills in half and things like that. It's just, I think, ridiculous that our senior citizens have to do things like this. Not that I feel like senior citizens need to be honored or anything like that, but certainly we need to take care of them.
But as a prescription drug buyer, the only option left may be to sit back and wait. For UI7 News, I'm Anna Yee.